Welcome back. And it's my pleasure to introduce you to the next session, which is health data for smarter, more resilient and sustainable systems. So the moderator for this session is the co-chair of the summit, Karolina Makowicz. And we've already introduced her, so I'm going to hand straight to her and she'll take you through the panel. Thank you.
Yes, thank you, Vladen, and it gives me a great pleasure to moderate this on the smart cities. I'm joined today by two researchers from two different countries. I have with me Jim McLaughan, head of School of Engineering at the Ulster University, and Arianna Dagliati, assistant professor at the Department of Industrial and Information Engineering from University of Pavia in Italy. This session is Society Summit, as of course that our city's built environment is becoming more data-driven and digital, and data can support decision-making in city planning for health and well-being. So we're looking forward to hear from two experienced professionals that work with the topic of data in the cities, to listen to their perspective and experience, and then we can use the data even better to provide to make sure that our cities are smarter and more resilient and more sustainable. So Jim, we would like to start with you to hear from you some words about how we can do that.
Okay, well, thank you very much indeed, and thanks very much indeed for the committee offering to give me a chance here to present our work. I take it that my slides can be seen by everybody, yeah?
It's very good, thank you.
Yeah, so excellent indeed. So I'm based at Ulster University, but I'm setting up a new, what's called City Deals Centre for Digital Healthcare Technology. So if I can just get my slides to move, here we go. That's our new logo, the Centre for Digital Healthcare Technology. So I'll just brief you quickly on that because that's got a huge impact on smart cities for the future. Our origin is an interesting one in the sense that I got involved with developing the world's first automatic mobile defibrillator. And I can tell you, even way back in those early days, it involved a lot of data to be access before we could get that FDA approved and out into the world. So we ran a 5,000 patient trial around the city of Belfast, and collecting the data from that in those days wasn't wireless. It was very, very troublesome, but it allowed us to produce, as I say, the world's first automatic equipment defibrillator that was allowed to be placed in homes, etc. That was with colleagues as well. I suppose I've spent the years after that developing a centre and lots of affiliated centres and spin out companies, etc. with that. So there's a good foundation and knowledge to take us forward into creating this Centre for Digital Healthcare Technology that really brings together academia, business and clinicians into a multidisciplinary atmosphere. Now, what tends to be important for us in this wide smart city environment is that we're going to co-ideate everything. So we need data to co-ideate, we need enhanced facilities to co-ideate, and we need highly efficient productivity pathways. That's why we're doing all this. And I suppose when we take it into the smart cities real dimension, you'll see then how that empowers the citizens of our city, etc., to move forward. There's a big team, there's a massive number of industry. We've just had Dell and Microsoft move in with us quite recently, and PwC and a few other companies like that to help develop this further. There's been a history of innovation success in this area as well. I'm not going to sort of detail these here at all, but just companies that have been formed and spin-outs have formed. And there's a big, you need this huge sort of skills base in behind you around everything from algorithm development to predictive analysis to the worlds of biomolecular sciences and health technology, etc. So taking that as a given, this is where the smart city part starts for us. We've just opened up in the middle of the city of Belfast a new £350 million campus. And one of the first things that all the IT providers and all the wireless providers have been asking us, can we use this, is very much a hub for the development of the smart city. So we've been working with BT, for instance, here, British Telecom, for 5 or 6 years with a £28 million project. And we're now about to extend that and use a lot of this building as the hub for the development of a lot of those home-based health concepts. And we very much see the new world as involving, you know, we talk about sometimes the world after COVID and the lessons that we've learned on how we've reset ourselves. With artificial intelligence, we used it a lot during the COVID period. We've used Internet of Things, automation, point-of-care diagnostics, and smart PPE. Those are the sort of things that we've been focusing on very, very heavily, and we think we bring some unique selling points to what we want to do in our own smart city. So I don't think I need to teach the world about what the definition of a smart city is, but it's very much, this is where I sort of come in maybe with a slightly different angle. It's very important to get robust electronic methods and sensors to collect the data right, and this is where the IoT world plays a huge issue, the Internet of Things. You have to be able to manage, it uses information then to obviously manage asset, resources and services efficiently and improve operations. And of course, it can be divided into 3 types of smart city, you know, the orchestration of intelligence, which is the old way of looking at smart cities, where established institutions, and we've plenty of these throughout the world, have just expanded. And Bletchley Park, that was the home of during the war, a lot of intelligence gathering was an important part of that hub. But empowerment of intelligence for the to basically create test beds, etc., has been excellent in the likes of Stockholm and Hong Kong. And where we come from more is instrumentation intelligence and trying to bring that into health around the surveillance aspect of it and gathering data to empower health decision making is really where we come from in that. I am having trouble just moving my slide for some reason. I have no idea what. Here we go. Right. So 5G healthcare is exactly where we're focused on at the minute. We've just put about 4 or 5 PhD students into this area, and a lot of it's challenging 5G and next generation 6G to work properly so that you have true mobile healthcare, particularly in wearables and smart medical devices. Now, joint with Dell and BT, they have further interest in transportation and in smart hospitals, and VR technology tends to be the themes that they use. There are disadvantages to a lot of this at the minute. The reliability and the real-time data collection, the lack of continuous monitoring of patients, the lack of data sharing, etc., are where the challenges are. But there are big advantages: the low cost side of it, the comfort side of the personalization, and the smartness of early detection. Those are the sort of things that are coming out as big advantages of actually using this real-time 5G aspect, which is, you know, particularly good for us. Just every time I touch my screen, it gives me.
Yeah, there is a bit of sound.
Yeah, I've just got a couple more slides to really show you. Just in Belfast, we have designated a smart city, really based around health and well-being, mobility, and energy. And this is in line with what those industry groups that I sort of mentioned to you. So there is a plan, and the plan very much at the minute is around a digital innovation pillar. Smart district and test beds, that's what's already kicked off, and then a makers network, and that's where over £120 million of funding is going at this stage. There's been a kick-off fund of about 20 million going into that. So the test bed is well up and going with the industry groups, and certainly we're also sort of part of that. You can see ubiquitous connectivity, engaged citizen showcase buyer, busting a resource challenge funds that go in to help with data insights, trialing and test bed environment, project assembly, and best practice. So those are the type of things we're seeing develop up at the minute. If I mention this as just one last point that I sort of wanted to make, is that all said in very nice pictures, to make things work at the end of the day, there needs to be efficient architectures of how data is collected. And this is exactly what we fundamentally work on, the likes of use of edge computing, clever ways of collecting the IoT data. You don't want to fill up data banks with tons and tons of data. So you want your IoT devices to be smart. And actually even back to the IoT device itself. For instance, that is a system there that we're currently using, as small as that. And that's nearly extremely important to actually locate IoT devices as real-time monitoring devices, as wearable, or fitting them into the likes of blood pressure monitors, etc. So the technology, I would argue, is extremely important, and it's why we run a lot of fundamental projects to try and get this robustness right in the system. And there's just some of the work we're doing at the minute. There's a large water project that's healthy and water. There's a major project. We're putting networks all over Northern Ireland for medical, using our networks for medical information gathering. And there's various architects that we're working on as well through PhD projects. So in summary, we've developed this new CDHT £42 million initiative in conjunction with Belfast City Centre that's pumping about 140 million into Smart City. We have living lab structures within that. We're embracing the Health 4.0 standards, and we're also integrating as much as we can all the expertise. Thank you.
Thank you so much, Jim, for providing this overview of what's going on in Belfast. This is very impressive, and I see that very also integrated vision for smart cities in Belfast. If I may ask you one immediate question. I used to work with the WHO health, so I have some overview of cross-sectoral work for health and well-being in the cities. And I think that often it seems that, well, health in the cities belongs to the health sector, and smart cities belong to the technology, to the IT developers. How do you see the collaboration? How do you also in Belfast make sure that actually those words work together, that all those systems and the technology that is being deployed actually serves health and well-being in the city? Can you comment shortly on that?
Yeah, no, absolutely. In fact, we're having a workshop stroke mini conference in November to focus a lot more in exactly what you've just said there. I suppose from 2010, with various MOUs between ourselves and the Department of Health, etc., and the Department of Economy, we've attempted to get this right. What I could argue with is that we have many examples of best practice. What we've failed at doing is trying to scale that across everybody that's interested in doing that. So scaling good practice in that area has been the challenge. We've had plenty of very good examples where there's champions on the health service and champions on the development side that can form relationships to get two things, to get research and data moving forward. But I think more importantly, to actually get embedded products into the procurement process and into the system to get properly tested to show true economic valuation. So those are two big challenges to scale and get right. And where we have interest at the minute is forming, this has not been accepted or passed, but we're lobbying very heavily for an independent body that would actually sit close to the Department of Health to be the interface for industry, academia with the health service. And that independent body would have more muscle than a normal innovation team that are usually there to try and protect intellectual property in areas like that, and therefore sometimes can prevent this interaction from scaling.
Thank you so much. And there was also a very similar question in the comment from the chat, how we can ensure a good collaboration between researchers and city decision makers so that their research is used in decision making. But I think that this is also something that Arianna will touch upon, and then we can also come back to this question together with Arianna and Jim. But now, after having this, like maybe maybe we will now zoom in from this big vision of Belfast City Deal to one concrete example of using some environmental sensors for understanding the health situation of the population in Pavia, and work being done in the framework of two international Horizon projects, research and development projects, Pulse and Brainteaser. And here, Arianna, if you can tell us more about this. So let's say that this would be this one use case of how we can actually bring the smart cities or improve the smart cities with some technology. Arianna, the floor is yours.
Thank you. Can you see my slides? Right.
Yes, I think we also see the notes. So if you want to just put the, yes.
What about now?
It's perfect, thank you.
Yeah, okay. So thank you very much for the introduction. And today what I'm talking about will be indeed a very specific example of Pavia, where we set up an infrastructure to collect environmental data and compute exposure within two EU projects, the Pulse project and the Brainteaser project. So this is Pavia. It's a town in Lombardy near Milano, and this is the Ticino River. It's near the Po. So indeed, Pavia, it's in the Po Valley. And despite the picture, Pavia, it's not really a big city. Indeed, it has a population of around 73,000 persons and an area of 60 square kilometers. So also Pavia has some unique features, indeed, in this relatively small area where everything can really be reached by walk or bike. There is one of the oldest universities in Italy, which hosts now more than 21K students, and also there are 3 research hospitals. The Policlinico San Matteo, which is one of the oldest and largest teaching hospital in Italy, the Maugeri Hospital, which is a rehabilitation hospital, and the Mondino, which is a neurological day hospital. Unfortunately, another feature of Pavia, it's an air pollution crisis, and this is mainly related to its geographical nature and the industrial context of the Po Valley. So in 2018, indeed, in Pavia, there were more than 100 days with air pollutant concentration above the limit set by the WHO. So these critical environmental conditions are urging, of course, the healthcare authorities to develop some specific intervention. And these are indeed the reason because Pavia joined the Pulse project based on the interest expressed by the municipal government. Indeed, the Pulse project started dialogue with stakeholders across 7 global cities to adopt a predictive approach focused on both health risk tracking and resilience for the well-being of urban communities. In Pavia, in particular, we installed more than 40 air quality sensors, which monitor air quality in real time, in order to compute the personal exposure model, that it's basically how much air pollutant every single person is exposed to. So the technological infrastructure that we adopted was based on 3 layers, a dense grid of low-cost sensor for air quality monitoring particulate matters. And they were installed all over the city, both in private citizen balcony and also in public buildings. A GPS tracking via a Pulse project volunteer smartphone, and the breathing model in order to compute the inhaled air. So thanks to this infrastructure, it was possible to precisely evaluate the intake of air pollution for each subject every minute, so with this really fine granularity while walking within the city. But even more importantly, how can we leverage this technological framework to shift from into this collaborative system and in citizen engagement? So the player, of course, here are the citizens who keep track of their activity and also generate data about the exposure. And then, of course, the public health organizations who have data about the general health of the population. So when we link these 2 players and also the data that are generated by these 2 players, we can then develop models which are the basis for novel policies to engage the population in managing their health, because they are actively involved in the process, but also we can provide the public health organization with some tools for the assessment of the evaluation of a specific health risk. So a very good example about how, let's say, Pulse provide Pavia with infrastructure to generate this kind of data, it's the Brainteaser project, which is a data science project that seeks to exploit the value of data related to health, lifestyle, and also environment to support patients with amyotrophic lateral sclerosis and multiple sclerosis. In Pavia, the Brainteaser partner, Fondazione Mondino, is one of the main reference center for multiple sclerosis in Italy. And within the Brainteaser project, the hospital will enroll more than 100 patients to study the progression of the disease and the effect of air pollutant on different disease phenotypes. The environmental data are also collected prospectively from the local installed sensors that we had from Pulse, but also from wearable sensors devices used by patients in the prospective study. And taking advantages of this cost-efficient fine sensor grid, coupled with clinical data, Brainteaser will develop a set of artificial intelligence models to study how environmental factors and personal exposure profile can impact on the course of the disease. So really the overall of the project is to anticipate and manage the impact of this risk factor. And again, here we have three main players, and I will go very, very briefly on how Brainteaser will impact on them. So patient and caregiver, they are expected to be empowered in self-monitoring the disease progression. Health professional, they can exploit these artificial intelligence models to have a more comprehensive perspective of clinical needs of their patient, and also to have some support, some support for informed decision. Also, scientific stakeholder, they can exploit the Brainteaser tool for setting up new clinical trials, and also benefit from the open science approach to share this data in open challenges. This is my last slide, and these are the partner of the Brainteaser project that I would like to thank.
Thank you, Arianna, for this overview. As I said, we will come back to the question about the collaboration between researchers and the decision makers in a short while. But before we go there, I wanted to ask you about this the personal exposure tracking from Pavia. How can this be applied in other cities? Is it only something that belongs to you, or do you think it can be also scaled up and shared with the other?
So the idea when we set up the framework was, of course, to make it as much flexible as possible. Indeed, this personal exposure, it's not computed only from one source of data, but it's computed from different sources of data. And so leveraging on these different sources of information and on like more specific techniques for interpolating all this data, we were able to apply this model in cities that have different kind of data, that can collect different kind of data. Indeed, within Brainteaser, we have 4 cities participating in the project. So Pavia, of course, but also Lisbon, Madrid, and Torino. And in all of them, the setting for gathering this data, it's different, but we are able to, as I was saying, like getting this data, interpolating them differently. And so maybe with not the granularity that we have in Pavia, but we still can have some good approximation for personal exposure.
Thank you so much. And definitely, it seems that Brainteaser not only have the value, of course, for helping to understand the disease and how the environmental exposure contributes to the disease, but there's well, side effect or another aspect where this could be also communicated to the decision makers and help to improve the quality of air in Pavia. So this brings me again like to this question that we parked for a second. So how can we ensure a good collaboration between researchers and the city decision makers so that the research is used for decision makers in the cities. And here I couldn't help but not to notice that in those three groups of stakeholders for Brainteaser project, you mentioned patients, health professionals, and scientific community, but not the decision makers. So how can we improve this collaboration? So the question to both of you, I don't know who of you would like to start.
Well,
Arianna, do you want to take? Yeah.
Fine.
All right. So Jim. Okay.
Right. Well, we have a good partnership with the Belfast City Council going back 10 years. As it happens, they are also the big funders, which has got the added advantage as well. So the relationship is very good, and they've got the vision, and the council have got the vision. I suppose it's a very technical concept, meeting with city planners, which is, so there are the obvious gaps there. So there have been very special appointments made as head of digital. And that post is at some extremely strong people. There have been 2 or 3 people in that post over showing the leadership for the area. And I think as they map that out, the benefit is that concepts that maybe involve some of the things that both of us talked about, which are quite technical to get it robust and how data is handled, are explained well. So I think the challenges and the explanations, and then how our city leaders have to work with the public to get them confident that data can be handled appropriately. So I think as I mentioned in my talk, the test bed is extremely important to get right. So there's been some good examples in the environmental side there given, and that's fed back into communications about the city of Belfast. Big stories come out of during COVID. The pollution went up, and that shocked everybody, and it's because everybody was using burners at home. But the data coming from the IoT system very much clarified that. So the same things now have been applied to trying to understanding airborne diseases and many other things in the environmental side, and some work going into the water systems. So I would suggest that started to show, some very good positive outcomes, and that they're very nice to be able to communicate. The challenges is now to do the same with health. Health is it's a lot harder, because it involves personal data and how personal data has been handled. We have government legislation that's been through our own legal processes here, and government processes for this last 2 years. I think that's important to get right. We know ministers now will back us more because they understand it more. And I think we're hitting that proper time of life now, particularly after the pandemic, where the doors are a lot more open and things have been stress tested during the pandemic. But so there's the technology to get right, and there's that whole bit of the, obviously the public engagement, and our city leaders are much better at that piece than us. So the partnership's the right partnership with the proper leadership.
Thank you, Jim. And what do you say on that, Arianna? How does it look from your perspective?
Yeah, thank you very much. So indeed, I think that in the specific case of Pavia and the Brainteaser project, we have a layer, let's say, of the public health system in between us and then the public stakeholder. So in a way, we are talking directly to them, and then there is this let's say higher hierarchy of public health, which is the main stakeholder we are talking with. So in that case, the impact it's clear. I mean, they can use this system and this framework for monitoring both the quality of air they are doing that normally, but with these kind of approaches, they can, let's say, zoom in and also have a clear vision of the whole population. Indeed, like in the past project, we also provide like this dashboard and tools for policymaker to, let's say, make informed decision about the risk. In Brainteaser, again, I mean, the focus it's more on a hospital manager eventually, and so I would say I don't see a very direct impact on within the project on changing policies. I would see more a change and impact on change how the process of care, which of course can have then a consequence on of different policies. Last but not least, this framework, with the sensors and the possibility to compute personal exposures has been also exploited, for example, for suggesting this is to cancer patient the best route in the city. So this might be an application that can be put like in place for municipality, for example, suggesting the people to do a walk in a less polluted area. So the impact it can be like different still, as I was saying. I mean, we have this middle layer, so it's us, then we have the hospital, public health system, and then the main municipality and government. So we have to see like all the effects step by step on what we are doing.
Thank you so much. And just well, I'm aware of the time. I'm mindful about that. And thank you for your patience and also for all the audience being flexible with time. Just very short comment I would like to hear from you. Jim said that, of course, we need to make sure that people are confident and comfortable with using also those solutions. Yesterday, we heard about different disruptive revolutionizing technologies, and of course we need to, and today we also touch on the issue of trust several times. So just very shortly from you, one suggestion also, how in building those smart cities that are full of technology, that rely on data, and after all, if those technologies are not being used by people, then they're useless. So what can we do, what you can do also as researchers to make sure that people are comfortable with using them? Do you have an answer? Jim, shortly from you.
I don't think there's a perfect answer. It's an iterative process without a doubt. I mean, case studies are usually good, and the pandemic has done us some favors in this area. So now the use of lateral flows or PCR testing, I think everybody probably now understands what that is, and understands the value of it from the point of view of control and demographics and an understanding, of the pandemic and its spread. Not everybody would be convinced that the routes taken were right, but the principle of actually monitoring and sensing and etc. was good. I think people understand that the health services in every country needs to be a lot more efficient, and productivity must be better. And as we age older, there's bigger challenges, and that some of the techniques, particularly remote monitoring that were used in certain countries, I think we need to profile that much better. The monitoring saved travel, the monitoring gave quicker decisions, and the monitoring was safe. So there are areas where that monitoring can be extremely valuable, So I don't think it's going to apply right across the board for every disease group. So I think we need to be clear that there will be certain areas that this remote treatment, the use of the likes of Zoom with diagnostics, etc., will be part of the smart group. I think the win-wins are going to be environment very, very quickly. That's where you're going to see in transport. You're going to see them much quicker in there, and health will come in behind that.
Mm-hmm. And Arianna, what about your opinion?
So I would say, of course, like engagement, direct engagement, also in the process of developing these tools, and assuring. I mean, this is a very practical things, but like especially when you use like GPS tracker, assuring privacies of and data security.
Thank you so much. And there was a question also to you, Arianna, about how do you estimate the possibility of the system, how it can be used to develop very detailed map of air quality. Is it okay that we share your email address in the chat with the?
Absolutely.
And for everyone, of course,
And
you're welcome to follow brainteaser.health and also social media. Brainteaser is both on Twitter and LinkedIn, and I'm sure that Arianna can also be reached out to LinkedIn. So please connect with her. And apologies, our time is limited, and this topic is of course bigger than 30 minutes. But thank you so much, Jim. Thank you, Arianna, for joining me today. We unpacked a couple of very good cases of how data on the local level and the municipality level can be used to create better health and well-being for all. Thank you so much.
thank you, Caroline.
Right?
Bye-bye.